Please welcome Dr. Beth Marshall, Associate Director, Johns Hopkins Center for Adolescent Health, with Jaytoya Manget, Faculty Nurse Practitioner and Director of Nursing for Children's School Services at Children's National Hospital, and Priya, Byati, Program Coordinator, CRISP, DC, in conversation with Jamie Ducharme, Health Correspondent at Time Magazine.
Hello, everyone. Thank you so much for joining us for this important panel on chronic absenteeism and how it relates to health. So Jaytoya, I'd love it if you could sort of set the stage here for us and explain what the CARE-H program is and what it's trying to achieve.
Sure. So we are a unique and innovative educational and healthcare partnership that really sought out to test the integration of school health data into our primary care system. So our full name is the Collaborative for Attendance Resources in Education and Health. And we actually have a graphic that shows how it all works. So at the school level, currently our partner is DC Public Schools. The parents consent to the program, and then their attendance data is sent through the Health Information Exchange. At the primary care level, we receive that data and then do outreach to the families based on the number of days they've missed.
Thank you so much. And could each of you, because this is really a holistic, wide-ranging program, could you each just briefly explain how you and your organizations fit in?
Sure. Do you want me to start? So my focus is on evaluation. I work with my colleague Megan Schutte in the School of Medicine, and we focus on continuous quality improvement, focused on program outreach, consenting process, partnerships, and then we look at attendance outcomes across the program years.
And I, along with my colleagues Danielle Dooley and Jessica Wise, represent the healthcare sector. So we receive the data each month from the Health Information Exchange. I also kind of oversee the flow of that data, making sure all the pieces work, oversee our quality improvement cycles, and then also work closely with our community health workers, who are really the heart of our program. They're the ones that do the outreach to the families via the phone, as well as go out to the schools and the community to really connect with the families and students.
I'm a program coordinator at CRISP DC, and so our role in this project is really just acting as a conduit of information. CRISP DC is the district's designated Health Information Exchange, or HIE, and those of you who are not familiar with an HIE that's just a secure electronic process in which healthcare providers can view and access patient information. And so in this project, our team works to get that file of consenting students from DC Public Schools. Then we match that file with a list of patients that are on children's patient panel. And then we send that file to children so that they can do their outreach.
Great, thank you. And Beth, I want to actually zoom out for a second to talk about why chronic absenteeism is a health issue. How can missing school affect a student's health both, then in the short term and longer term?
Thank you. It's a good question, because typically we think of chronic absenteeism in education, and school absenteeism or chronic absenteeism, where a student misses 10% or more of a school year, is really an indicator of child health and development. States use it, the majority of states use it as an accountability measure for education systems, but really it's a symptom of systems not working for young people. So it's a symptom, systems aren't working for young people. And when we think about education, the risk and protective factors for chronic absenteeism largely lie outside of education. So that's where public health comes in. It's a public health problem because when we think about it, about 25% of students in the US are chronically absent. It affects every state, it affects every district, but it disproportionately affects students within those states and districts, particularly students of color, students whose family experience low income, students who are experiencing homelessness, and students with disabilities. And when we think about health in the short term, if a student's not in a school building, they're not just missing academics. They're missing critical health services. So access to school meals, access to school health services through a school nurse or through a school-based health center, therapeutic services like OT and PT, school-based mental health services. And when we think about like sort of the longer term, we know that when young people are not in school in the early grades, they're less likely to read on grade level by 3rd grade. And that is an indicator that they may not graduate. We see in adolescence, young people who are not regularly attending school are often more likely to engage in health risk behaviors like substance misuse. And we see in high school that chronic absenteeism is a stronger predictor of high school graduation than test scores. And we know in the long term that young people who do not graduate high school have health impacts across the lifespan. So higher increased risk of mortality and lower life expectancy.
And Jaytoya, do we have any data from the first few years of CARE-H's implementation to show whether it's working, whether it's addressing any of these problems that Beth is talking about?
We do, and there are many things in the program that we are proud of. The first just being the data exchange. Historically, as primary care providers, we did not have a way to see what was going on in the schools. We could, go by parent or student recall, but now we actually have real quantifiable data that tells us how many days the students are missing. So from there, we've been able to connect with many families that have also been out of touch with primary care as well as their specialist visits and get them back into care. In our second year of the program, we did start social determinants of health screening as we were doing the outreach, which was very important because we did find that many of the families that had students that were chronically absent also were experiencing food and housing insecurity. So then our social work team was able to connect them with those resources. And most recently, we're really proud that our latest analysis has shown that students that had outreach during our second year of the program had statistically significantly fewer days missed in the 3rd year. So those that we were able to contact in year 2 and potentially provide resources with had 5 fewer missed days in the 3rd year. So that we're really proud of because that's an entire week of school for students and really does make a difference when we're looking at the chronic absenteeism markers.
Yeah, that's really striking. Thank you. And Priya, I want to talk about the ways that data is used to facilitate these health outcomes. I mean, it strikes me that it's pretty unique to use school attendance data in this manner. So are you and your colleagues at CRISP-DC kind of thinking of other unique ways to use data or to share data to further improve public health?
Yeah, certainly. The CARE-H program is definitely a unique project and one of my favorite public health programs that I work at CRISP-DC. But within CARE-H, I have had the opportunity to participate with the National Attendance Data Learning Collaborative, which allowed us to learn and share our work with other states. We've also been in talks about expanding this program since currently this is only a pilot at Children's. And then outside of CARE-H, CRISP-DC does work on utilizing a lot of variety of different unique public health data sources. Most notably being our unique partnership with the DC Department of Energy and Environment, where we work with them to share lead blood level results with providers, DC WIC, and DC Water, and DC Public Schools. We also have our social needs program, which allows users to refer their patients to community-based organizations, allows them to search for community resources, and also to conduct social needs assessments. We also are able to parse C codes, which are basically non-medical factors, from these electronic documents that we're receiving from organizations and display that in a separate tab. We also have the social determinants of health pop health reports, which allow our users to visualize social determinants across census tract, ward, or neighborhood. So there really are like a lot of different things that CRISP-DC is working on to make sure we're improving public health.
Awesome, thank you. And we have 40 seconds left, so this is like a speed last question.
Okay.
I'm curious, we heard so much about chronic absenteeism in the wake of the pandemic.
Yeah.
We're here almost in 2025. Why is it taking so long to recover attendance?
You know, I mean, I think chronic absenteeism is really driven by a variety of health and social factors, and we bucket them into like barriers to getting to school, aversion to school, disengagement from school, misconceptions. And if you look across each of those categories, the pandemic just exacerbated all of those factors. And so while we've made some progress, we're nowhere near pre-pandemic levels, and it's going to take a collaborative systems-level approach. It can't be solely on students, families, and the education system.
Right. Well, thank you all for sharing about this innovative program. Thank you for being here.
Thank you.